too.
So, Dr. Henley, there's a lot out there in the media, all these celebrity magazines, they come out, they show these celebrities, and it really makes the regular people aspire to look like them. But, as you know, some people take things a little too far. What are some parts of the face that you think people just kind of take it in the wrong direction?
Well, celebrities became celebrities because they were good looking to begin with. And then when celebrities age or they want to go that extra step, they should do it with good aesthetic balance. When you take somebody who's older, a 60-year-old attractive lady, and you give her Angela Jolie lips, this is going to look out of aesthetic balance. And what I see is that either some patients or some of their doctors are exercising not good aesthetic judgment. By that I mean maybe the patient is demanding such changes, or maybe the doctor is exercising their judgment. So for example, if there are procedures that are a breast implant, if a media promotes a 5'2" petite lady with 1200 cc implants where she's almost toppling over, I'm not sure that's good aesthetic balance or a good example to our aspiring people who want some changes. So the best changes are the ones that restore the aesthetic balance. When the nose is too large, you make it a little smaller that blends with the face. That's a good result. It's not a 6-foot-tall man with a small nose of a girl that's going to look out of balance, and it's aesthetically not pleasing.
So people in general should strive for facial balance. They shouldn't pick out a celebrity mouth and say, put this mouth on me. They should say...
Well, if they're looking for good cosmetic surgery, then they should be restoring aesthetic balance. If they're looking for a transplant, then they should get somebody else's lips.
Well, I'm sure many women will say, yeah, I wish I could get a transplant, but it's true, you can't. You have to work with what you have, and I know with lips especially, it seems like a lot of women out there are going a little nutty with the lips.
Well, and I think that when people do these extreme versions, or that lady who wanted to look like a tiger, that kind of extreme surgery, I think it gives a bad name to sound aesthetic surgery. And I believe that most practitioners who practice this art and science exercise good judgment and good skill. But the media seems to worship these extremes. As the media worships extremes in crime, we seem to worship the extremes in cosmetic surgery, and you have people with almost distortions parading around, and media gives them a lot of attention.
And even if it's bad attention, it still is attention, so it sends a mixed message to the person who might be thinking about that.
And I worry about our youth, so the young girls who are trying to fit in and be fashionable, when they see examples of some of our, that are being promoted by the media, of more extreme appearances, I'm not sure it's healthy.
So that actually raises a really interesting question. I know, when you're a teenager, the things that, boys say to you in school or girls say to you in school, you're not mature enough to deal with it. So I would presume that you have seen a rise in younger people wanting to do lips and eyes and whatever, what have you, and make these changes. What's your advice to their parents?
Well, hopefully when the parents are listening to their concerns of their teenager, and they come to visit the physician that's going to work with them, it's hopefully the physician is able to give them mature advice about what's right and what's not right. I mean, I've had teenagers who requested changes that were totally unreasonable and would not look good. Sometimes they have body image issues that will resolve as they mature, but at that stage you don't want to be doing procedures that are just responsive to their body image concerns.
Interesting. Okay. So I think, actually, you know what? I had one more question that I was always very curious about. What made you get into facial aesthetics and aesthetics in general?
I seem to have a predilection for it, and it's really the only part of a surgeon life that has a creative flexibility. You're designing an operation for a specific patient. It's not that you have a patient and you're executing a specific operation. You also design the combination. Sometimes you will do cheek elevation with eye lift. Sometimes you will do a face with a nose. If the lips are out of balance, I will enhance the lips. So it really, the process is customizing the surgery and the procedures for the benefit of the patient, rather than the patient comes in with this tumor and needs this operation. So that's what the aspect of being able to design the procedure for the patient was most attractive to me.
Interesting. So you want to be a little bit of an artist. Although scientist, there's art involved in it too, for you.
Well, it's very much so. I mean, it is one of the few areas of medicine where creativity is rewarded
Well,
and respected.
and you love it because you have patients that you deem your favorite patients. So, like, what makes a favorite? What's like a favorite patient?
The favorite patient is the one that has reasonable expectations, and their life or their self-esteem is not centered around the pores on the tip of the nose. So it's the patient who has a profession, who knows who they are, and they want to improve their appearance for a specific reason because it will make them happy. That's my favorite patient, is the one that has certain structural challenges, but nevertheless is a whole person to begin with.
Well, you've been a whole person to begin with and end with. Dr. Henley, thank you again for taking your time today, getting some great insights from you. We really appreciate it. Thanks.